Hi there, Elizabeth Scala here from elizabethscala.com. So today we're going to talk a little bit about silos. Now, if you're in a large organization, as I have historically worked myself, you understand that sometimes departments, nursing departments, even the types of professionals, so nursing, PT, pharmacy. But back to nursing, if you think about the departments, surgery, medicine, the emergency department, kind of siloed off, working in their own specialty with their colleagues, their nursing leadership structure, and maybe even smaller siloed into their specific unit, right? Now, if you're at a larger organization, whoa, loud noise. This may or may not happen. I haven't worked at a small community hospital myself, so I'm not sure. However, I have another example for you. How about handoff? So even between units, a patient has to move in and out of the system, in and out of the hospital, from the community into more tertiary setting, back out into the community, within that hospital itself, from maybe a prep area, a pre-surgery area, to the operating area, to the post recovery areas, to step-down units, to intensive care units. Okay, so patient flow may actually create, unintentionally, some silos. What's my point? I hear from people I work with, I hear from nurses over the internet across the country. I hear and read a lot in the nursing literature about handoff, communication, trust among various settings, nurses practicing in various areas. And it's extremely interesting to me because if you think about nurses, we all have one thing, most of us, at heart, which is patient care. We all want to do best for the patient. So when I hear about nurses not getting along, not trusting each other, not communicating, not working collegially among departments, among specialties, among areas of practice, it's disconcerting to me. I'm sure for you, if you have an example of this or if you have experienced this, go ahead and leave a comment below this video. I'd love to hear about your experience. And now, how do we handle this? What are some strategies that we can use? Well, I think that the number one reason we have these issues of mistrust, of communication breakdown, of, they're not taking report when I call them, is because we are so focused in where we are practicing. We are so sort of at the bedside in our clinical work. Our tasks, our checklists of the day, our patient in front of us and what they need. We are doing less of a good job, if you would say, at thinking about the global picture, the bigger picture, thinking about how that patient is moving throughout the healthcare system. So what can we do? One thing I recommend is networking. And you can do this online on the computer via LinkedIn. Keith Carlson of Nurse Keith Coaching knows a lot about LinkedIn. I find LinkedIn really wonderful to connect me with groups. You can learn about other specialties. You can enter those groups and read the dialogue, the discussion, understand the challenges that they are coming from. You can also network in person. And what I mean by that is going beyond your specialty area. So one example is my organization brings nursing leaders together monthly for a forum to learn about, discuss, come up with strategy, socialize. But what I notice is that the tables people are sitting at are specialty focused, sitting with the people you know. So maybe in your organization, in your role as a nurse, can you network? Can you get beyond your clinical area? Can you go visit another unit? Can you call up and say, hey, can I just watch the charge nurse for a couple hours today on this particular unit to learn about their workflow so you know where you're sending your patient to, so you can trust that relationship. Networking online via LinkedIn, I already mentioned, but beyond social media, you can read blogs. So lots of nurses are out there writing about their experience in their specific area. I know a great blogger, a mommy nurse blogger who writes all about OB and labor and delivery and things that mommies need to know. Now, I don't know anything about that, but I read about it and learn from her perspective, from her area of expertise. So my encouragement with this video today is to think about ways to network. You gotta kind of get outside your box. Go see what other nurses are doing. Go learn from them. Go listen. Maybe read another nursing journal instead of always picking up and, your mail, which has your nursing journal, I'm sure. Any of our medical libraries, many of our organizations allow access to journals. Can you thumb through and read some articles to learn about what the other specialties are up to? And then my final recommendation would be conferences. So of course we can attend our own specialty conference, and that's what helps us bring things back to our workplace to implement best practice. But what about getting out of your specialty? Attending leadership conferences, the Magnet Conference, Sigma Theta Tau conferences that are not so specialty focused. And when you go with an eye for, in addition to learning what you need to know in your particular specialty, understanding, kind of rubbing shoulders with, again, networking, learning from other specialties, seeing how they experience patient care. That way you can increase the trust among levels of care, enhance the communication, break down those walls of those silos, and all be effective for that patient. Thanks for watching, and for more information, helpful tips and resources, visit elizabethscala.com. Thank you.